How is health insurance funded? Many different ways. 1. You pay directly, and control by choice, the quality and quantity of care you receive. 2. You pay indirectly through private insurance, losing some of that control. 3. You pay indirectly through government taxes, losing pretty much all control. 4. You don't pay, hoping someone else will pay for you, either through charity or taxes. 5. You don't pay the hospital or charges, and let the hospital cost shift your charges to those who do pay. 6. The current healthcare system, and I use that term very loosely, is a public-private partnership. 7. Unfortunately, too much of the taxpayer-paid, public funding goes directly into the unrestrained profit-taking of the private half of the partnership. 8. The VA system is publicly funded, and has severely constrained profit-taking by the private healthcare corporations it contracts with. That's why the private corporations work so hard to kill it with budget cuts, not caring it's our veterans who are hurt by them. Generally, it comes from 1. Premiums. This is your monthly payment to the insurance company. 2. Government subsidies. Premiums are fairly straightforward. It's like your car insurance, you pay them monthly, they pay when you need them. For the government part, this is a US-centric answer, as this will obviously vary by the government. Payment from the government comes in a variety of ways, but probably the most common are insurance companies which sell Medicare Part C, Medicare Advantage, and Part D prescription drug plans. Because seniors are covered by the federal government as part of their entitlement, but their healthcare is administered by private insurers, the government will pay the insurance company a set monthly amount per member, varies by region, health, and the plan's bid, and the insurance company will pay the healthcare providers, hospitals, doctors, pharmacists, medical equipment suppliers, nursing homes, etc., for any individual services rendered. If there is a difference between what the insurance companies get from the government and what they pay to healthcare providers, either positive or negative, those profits/losses are shared with the federal government according to various formulas. The government also pays insurance companies by subsidizing low-income people and other vulnerable groups, through programs like Medicaid and ACA. Medicaid is a state-level insurance program with federal funding, so it's state governments which decide how to pay for health care. Using federal funding, percentage varies by state. Many states prefer to use managed care to administer their Medicaid programs, which means the state gives money to the insurance company, fixed monthly amount per person, and the insurance company pays the healthcare providers. So generally speaking, insurance companies will get a lot of money from the government, on behalf of people that the government has decided to pay for. These people are generally old Medicare, poor, Medicaid, ACA, or very sick, disabled, which is highly correlated with being poor.